Hi everyone, thanks for joining us for today's meetup. On today's agenda, Chris, Walt, and Scott will be providing an overview of the new homelessness and opioid maps and apps. Just a reminder, we'll be recording and posting this meetup on meetups.com. During the meetup, if you would like to make comments or chat with other participants, then use the chat panel. However, if you'd like to submit a question for the team to answer, then please submit it through the Q&A panel. With that said, I'll go ahead and pass it over to Scott.
Thanks, Heather, and thanks everyone for joining us today. Today we want to take some time to share with you some work that we did earlier in 2017 to help communities tackle the opiate epidemic and also reduce homelessness. And what we'd like to do is really do a deep dive into the solutions we developed to help communities tackle these public health initiatives. And you may be asking yourself, kind of why? Well, if you read the paper or any trade magazines or watch the evening news, you'll see that the opiate epidemic and homelessness are issues that are gripping communities all across the country. And there's a lot of conversation around the human impact, the public safety impact, and ultimately the financial impact of the opioid crisis. And homelessness is also an issue that's having a direct impact on communities as well too, and it's impacting not only social services that are being provided in the community, but ultimately driving a whole series of conversations around affordability in many communities across the country. And so these two major issues, so these two major public health issues, are large policy conversations that are happening in many communities across the country. And ultimately what we found as we dug into these solution offerings is they very much are a set of horizontal initiatives that are cutting across many different departments in a community. So today we'll talk a lot about how public health and public safety agencies can leverage the solution offerings we have, but know that these are issues and these are challenges that are being tackled across many different agencies in a city or county, and ultimately many different parts of the organization as well, both inside a city and also outside. So I don't want to spend a whole lot of time with context. We really do have a lot of things to show you today. And what I want to do is introduce Walt and Chris and let those guys really dive into the solution offerings we have. The one thing I will mention to the group is that we are going to show you several different solution offerings. So if you do have questions along the way, please do stop to ask us. And I know we've got time to take questions throughout, and I know Walt and Chris both would welcome your comments and feedback. So without further ado, I'm just going to go ahead and turn it over to Walt, and we're going to start with the new opiate epidemic solutions we've developed, and then we'll wrap up with the homeless work. Go ahead, Walt.
Hi, everybody. Thanks a lot for joining us. We do have quite a bit of information to be able to share with you today, so I'm going to jump right into it here. Hopefully, Scott, everybody can see my screen all right. Yeah, as Scott mentioned earlier, last past June, we released several solutions to help local government agencies tackle the opioid epidemic. We did a real high-level overview of it back then, and today we'd like to get into a deep dive, so there's quite a bit that we're going to show you. One of the things we wanted to point out is the approach that we used when we were creating and delivering these solutions that you're going to see today is that they have what we call both a comprehensive and collaborative approach, in that we intend these applications to be comprehensive in that they are for many different agencies throughout local government, and the collaborative, meaning that you can share that information, as you will see, between the different applications. So as you see them, keep that in mind. We also wanted to try to help local governments by delivering applications that can address each of these four elements of a comprehensive epidemic response for opioids. In the first case, it's improving education awareness. We've learned that that is one of the biggest issues. As you see the CDC reports, they mention that quite a bit. Also, to be able to communicate the treatment options within a community and give that to people that need them. To be able to quantify the opioid response activities and then provide successful prevention programs. So as we go through these applications, you'll see them in each of those four areas. The collection that we're going to show you has been designed for very specific business needs across the organization. Again, the comprehensive approach. On the left up here, you can see that we have an opioid awareness maps that can be used by public health and safety officials to be able to better understand and communicate the severity of the opioid incidents in their community. We have a couple locator apps for opioid treatment facilities and pain management facilities, one for health inventory, so you can track and inventory homeless facilities and drug treatment facilities and so on. We have a few preventative type applications for drug drop-off locations, drug calculation of how much drugs have been dropped off at each one of those facilities, a drug activity reporter for the citizens, as you'll see, to be able to communicate illegal drug activities around the community, and then a couple of response applications as well, including one for the naloxone deployment reporter for first responders to be able to communicate where naloxone has been deployed, and then an overall opioid response dashboard for internal use within the local government agencies to be able to monitor all the response activities. So that's a little overview of them as we go through here. Keep in mind this picture here. All these different apps are made to collaborate and work together and share that information. So let me just get into my app here. So we're going to start off here with the opioid awareness maps. This is a configuration of ArcGIS Pro, and it's designed to allow someone within the local government agencies, whether it be health, to public safety, or somewhere else, to be able to size up the amount of overdoses, death reports, and so on that are going on regarding opioid activity in the community, and then to be able to share that information to the public. So I've got some sample data on here. We got several things like death reports came from the coroner's office. Maybe we have some overdose reports, drug reports that came in, and so on. So we're going to walk through this process of how would you communicate that, get that information out to people that need to be able to make decisions on that. You'll see that this application comes with a set of tasks over here on the right side, and I've just opened it up so you can see the whole thing. And these tasks here allow the person that's going to be doing this at work using Pro to be able to pull in data, publish it, get it to the information inside of apps and maps that those agencies can use or share it with the public. So let's just walk through these then. The first one on the list then is the Get Started task. And what it's asking us to do is publish a new hosted feature layer using the opioid incidence layer in the ArcGIS services catalog. So I'm going to open that up so you can see what that looks like. And in this feature service, you'll notice that there are 3 different layers. Each one of these is a point layer: overdoses, deaths, and seizures, drug seizures. And I'm just going to open up the data tab so you can see a little bit of what that schema looks like. So what you get then with this, when you create this, publish this feature service in your organizational account, is a service that has 3 different layers with this schema in it. And I'll just scroll down through. You can see what they are for the other layers in there as well. And then the idea with this is once you've published that into your organizational account is that you can then go back into your Pro configuration here and then organize your data. So I'm just going to hit the next button down here and say, well, what data do you want to push into that empty feature service that you just published? The advantage to that is that that empty feature service has the schema, the visualization, that is the symbology that's already been designed for you, and you can leverage that if you want. You can also make changes to it once you've published it and then push your data into that feature service if you like. So there's a couple ways you can do that. So we're just going to get started on here. The first one on the list then is to import existing incident data. So if I've already got some incident data and it comes in the form of a geodatabase or something like that, like maybe I've got this death reports, which is a feature class in a geodatabase or shapefile or something. I've added that to my map, and then I can use that to populate one of those layers that I just showed you earlier. So I'll just hit the next button, and it goes through this process. You can select out what type of incidents. So if I want to, I could add a clause in here, and whoops, I guess the first thing I need to do is list the table that I just added. So I got these death reports, and I want to add in there what type of information I might be interested in. Maybe the cause of death, maybe the drug was found or the toxicant or something like that. I could add that information in there, and then it will select out just those types of deaths, maybe overdoses or maybe from some certain drug in that death report. And then I can load that data in there. So again, I select out my input data, which is simply the death reports, and then I can select what target data set it's going to. And in this case, I've already published an empty feature data set, if you remember from there, called the opioid incidence. And in this case, it's going to go into the deaths layer. So I would select that out. And what this task allows me to do is it gives me a choice. If the 2 schemas match, that I can just allow the default, or I can select the field map to then associate the fields from the input layer to go into that output layer that's now feature service in my organizational account. So that's one way that you can populate the data that's just coming in from some source. Could be some one of your colleagues within the organization. Another way that you might want to do that, I'm just going to turn off these depth layers here, is to be able to geocode it. So let's just say that I've got some data that was given to me perhaps by the coroner's office, but it was in the form of a CSV file. So I'll just select on the CSV there and add that to my map. And it's not geocoded. It doesn't have any X and Y, so I need to geocode that. So then I can add that to my list and then go through this geocoding process. Again, select off the input table, which was the CSV file that I just added, and then select what address locator I want to use. I'm just going to use the World Geocoder in this case. You could use your own if you had to, if you have one, I should say. And then you can then list what fields you want to use for doing the geocoding. In this case here, I've got a field in here called the addresses in here that I would run. So that would create a new geocoded layer that I could use in my input data set here, and I've got one already set for us that we can use. And then the target data set, once again, would go to the online account that I had previously published. And if I hadn't already populated the desk, I could do that this way as well. So that's a couple of different ways that you can populate data using that IMTA feature service that is available to you in the service catalog. So once I've got that done, I've got some deaths, I've got overdoses and so on, things like that, that I can look at and say, well, how big is this impact in our community, given the information that I have available to me? I might want to then aggregate it, and I can aggregate it up to a higher level, geographic level, such as a city council district, a township perhaps if I'm a county, maybe a ward in a bigger city and things like that. So to do that, I can use this task here. So I'm going to select on the aggregate opioid incident data, and then it's asking me to say, well, what data do you want? So what reporting area do you want to have in here? So I happen to have a council district already. I've actually loaded that onto my map. So I hit cancel here and then hit next step in there. And then say, okay, we're going to select out the type of incident data that you want to aggregate to those city council districts. So I could again select off my, my death reports if I wanted to. And I might want to select out things like deaths where the age was under less than 25, let's say, and add that as one of my items. Now, what I'm going to do is I'm going to create a new map that's going to aggregate all those deaths for those that died under age 25, and it's going to create a new map that I can add to the layer. Then I can select out those polygons, which were the incident layers, and what I would end up with is something that looks similar to one of these over here. So I've got a couple of them that I've already created. This is deaths over 25 and under 25, so we might be able to compare those by each one of the districts. So right away, I can see some information that might be useful to you. I can do the same thing with overdoses if I have that information at the same geographic boundary as I want to, and also then saves from naloxone saves. And I'll explain to you the naloxone saves. If you haven't heard of that before, naloxone is the drug that temporarily reverses the effect of the opioid overdose. And it's used by first responders around the country. So it's helpful to be able to track where those naloxone saves were done within those council districts. Gives you an indicator of what might be coming in the opioid overdoses or deaths. So that's the ways that I can aggregate my incident data that I have received. Now, the next step is be able to share that reporting layers so that I can share that with staff, maybe in the public health, public safety, some other agency, or if I want to be able to share that with somebody in my organization. So I'd select off one of these and hit next, and then it'll go bring up the report layer. So now I can tell it which layers I want to. In this case, I'm going to select the whole group. I've grouped all the overdose information into this layer here, as you can see in the contents, and I would publish all those layers to my organizational account, and then they can be consumed in online applications. So that's kind of like a high-level overview of some of the capabilities that's available to you in the opioid awareness maps, and again, the pro configuration. I'm going to transition to how that data can be used online, but before I do that, I just want to stop for a second and see if we've got any questions so far that someone has asked.
Yeah, there's one question related to the hosted feature layers.
Mm-hmm.
Is this workflow when setting up the solution for the first time? Empty feature layers will be populated this way. And what if we want to update existing data in a feature layer? Do we simply override the feature layer?
Yeah, those are good questions. Yeah, it starts off initially as an empty feature class if you follow these steps here, and then you would be adding data into it, appending data into it. A couple good questions about that, like, well, what if I've got data that I want by year, for example, or something like that? It's up to you how you want to organize that, of course. You probably have your own methods, but if it was me, I'd probably organize it either by year or something like that. So deaths in 2016 versus 2015, and then create a new layer in there to populate that with new data as I get it in. But I think that would probably be dependent on the organization and your specific needs that your end users have.
Okay, that is it for now.
Okay, very good. All right, let's go on to some other apps. As I mentioned earlier, there are several different online apps. Some of these are organized in one of those four categories, those elements. In this case here, we're going to go through a list of prevention type solutions. The first one here is the Drug Activity Reporter, and this can be used by citizens. It's a configuration of ArcGIS 123, or excuse me, Survey 123, that allows citizens to be able to report on a drug activity that's happened in their community. And Survey 123 can be made so that you can hit it from a website so that this survey can be published, or it can be used on a mobile device as well. In this case here, we've just selected off a few things, like it's a type of drug activity here, and the survey has been created for us. What type of drug was observed? If we have any details or comments we want to put in there, the date. If we happen to be able to take a photo of it, we could add that in here, and whether or not we want them to contact us. So if I'm a citizen and I want the public safety agencies to contact me and let me know what happened with this report, then I could do that, and then also indicate where that drug activity was at. And so this is a way for law enforcement officials to be able to gather information from the citizens and kind of cooperate with them and let them know what the outcome of it was. So that's an application that for the citizens to be able to access. Internally, if I'm a public safety officer, maybe I want to manage those drug activity reports. And so as they come in, I would have an application like this, which is a configuration of the crowdsource manager that allows me to manage all of those reports as they're coming in. So I have all the information that was received, including the photo, and then have information that I can assign it to somebody within my organization to be able to follow up on it if necessary. So that's a good way for me to be able to keep track of things. Now, we also have a drug activity dashboard. If we want to collect information that's coming on, what by the type of drug activity, in this case, we just have the one that we submitted, but we might have several different types of drug activity, heroin use. We might have some other things like drug sales or prescription pill fraud or something like that. So we would be able to monitor what's going on in our community through these drug activity applications. Another type of prevention activity or solution is the drug drop-off locator. Many communities across the country have different facilities they use to drop off unused prescription drugs. And this locator application can be used then by citizens and the general public to be able to type in an address where they live or somewhere and find the closest drug drop-off locations to them. And then once they find it, they can select it off the map to get more information. They could call them to find out what the hours are or whatever. And then of course they can get directions from them as well. And then of course they can select, use whatever distance they want to, specify that distance right here. So this is a good way to communicate with the public where they can go to drop off some of the excess prescription drugs that they may have. Once that's been done, that information has been received, those drugs have been received at each one of the facilities, in this case here at Fire Station 1, then we can have one of the people, the staff at the fire station, indicate how many drugs have been dropped off and what date they are. So it's a good way to see how much we're collecting in each one of those facilities, and do we need more facilities across the community or not. So it's a good way for us to get an understanding of what's being taken off the street, what's not going to get used. So once that's been done, then we also have drug drop-off reports. And this is a good way to say, well, how much is being done, when at each one of these locations. So in this case here, we have Fire Station 1 that's received a couple different locations, and you can see there's quite a few pounds of drugs that have been received at each one of those by the citizens. This is becoming more and more popular, I think, as the National Take Back Days get popular and get used around the country. So these are 3 applications you can use to help in the prevention of getting drugs off the street. All right, so we're going to transition to some new apps here. In this, the idea is to communicate where citizens can go to get drug treatment, opioid treatment. And we've got another Locator application. It's a configuration of the web app builder, and it uses the Near Me widget you'll see over here on the right to be able to allow citizens to enter in an address, or they can select off the list the type of facility that they're looking for. In this case, I just entered in an address, and then I get a list of the types down here. Of course, then I can select one of those, and as I select that treatment facility, I not only get the information such as the name of it and the address and phone number, but you can get the information on what type of facility, what setting it is, what treatment approaches they offer, what special programs, and so on. So it gives you quite a bit of information that you can use, and of course, then you can get directions to that as well. So this is a locator that can help people that have a drug problem that want to get treatment on it in one of those type of areas, either perhaps drug treatment at a hospital or clinic or a mental health facility. Another type of locator that's very similar to that one is the pain management locator. So an alternative to taking opioids for pain management is a different type of facility or service, including like physical therapy, massage, hypnosis, chiropractic, and so on. And so this application allows you to find those alternatives if you don't already have, an opioid addiction problem, but you have pain, you want to find a place you can go without taking opioids. This is a way for communities to communicate, provide that information then out to their public. So those 2 applications would be made available to the general public. A couple other ones. So we have for the response type applications. This one, as I mentioned before, the naloxone deployment reporter is be used by first responders to be able to track where they have deployed naloxone in an overdose emergency. So someone calls in 911, they report an overdose, and most cases you can do that. And most states have a Good Samaritan law where you do not get prosecuted if you call in and report that somebody in your house or your office or whatever school has overdosed, and you can provide them with all the information that's necessary so that the first responders, when they come, they know what type of drug they are dealing with. So it allows them, after that emergency is done, they can enter in the information in this Survey 123 configuration for that particular location, the type of drug that they treated it for, and the treatment method. Usually it's one of these 2 methods right here, and the number of doses, whether or not the patient was conscious, breathing, some other things about the age, race, and so on whether that was previously administered to that patient and what the outcome was. There's a couple advantages to using an application like this, and one of them is not only can you keep track of the inventory of the naloxone because it is expensive to purchase for most local government agencies, but it also helps you keep track of where are the bad drugs, where is it being distributed. And the one that's of concern these days is fentanyl, is the most deadly. And when a batch of fentanyl hits the streets, it has deadly effects on the community. So that's one way that this this application can be helpful to first responders that want to keep track of that.
Hey, Walt?
One thing I wanted to share, go ahead.
Oh, no, I was just going to say, the other thing that I found interesting when we were working with folks last spring on these solutions is that this is also probably some of the most near real-time data that communities have on the epidemic itself,
Yes.
right? Is that what we heard from many people, right? Are the death and overdose data very much is kind of rear view mirror or rear view looking data,
Right.
because it takes so long to process it, and with the coroner reports and things like that. So this really is, like you said, kind of it is kind of the nervous system of what's going on the street right now in the community.
Yeah, that's right. And I should mention that not only can this be a survey that you publish using Survey 123, but you can also use it inside of a mobile device if you have the application on your mobile device. So there's a couple of ways that it can be deployed. Speaking to the point that you just made, Scott, regarding timely information, I think it's important for our users to know that with Survey 123, you can go into the Survey 123 website and log in and then see your surveys that you've published and see how the updates have been changed, or see how the information that's been received. It's helpful for what I mentioned earlier. What you really want to keep track of is this one right here. Is this increasing in your community or not? Or if there's some other type of drug that's in your community. So it's a good way to kind of keep track of that as it's coming in on a daily basis. You could do some other things in here besides just the drug. This is just one of the questions, as you remember, in the survey. So it's a good way for us to monitor what's happening in a near real-time way. You can get the number of responses and the count, percentages, and so on. It also has the other questions that we had in our surveys, such as the treatment methods. So it gives you a good overview. Some of the number of doses and whether they were conscious or breathing and all that other stuff. So this is also a tool that you can use, and once you've created your survey, it's available to you to use. So it kind of adds on to what you were mentioning there, Scott.
Mm-hmm.
Along those lines, regarding response activities, the opioid response dashboard is a good way for a community to keep track of what's happening. So this would be for internal view, so public health officials, public safety, law enforcement, so on, could use this for multiple different reasons. So for example, on the second tab here, we can see that we have a list then of overdoses. You can see that we have those that happened within the last 90 days or previous 90 days, so we can kind of compare trends to see what's happening. One of the things that we might want to do in here is if I'm a, well, let me just search for fentanyl, see if I've got anything in here on number of fentanyl. I don't think I do, but I don't, I guess. But I could check for the type of drug that was used to see if there is one. Maybe I can do it in here. But it's helpful for me to search through and see what's going on in my community. For whatever reason, it's not working right now, but it's a good way to search for things. Again, I'm looking for changes and patterns between the last 90 days and the previous 90 days. I can do the same thing for naloxone deployments, as you mentioned, Scott. If I want to track on what's happening specifically, this one maybe happened in the last few minutes or something like that. Then I can look at it and see, get the details of that particular incident. We also have drug seizures. So as law enforcement, they go out and they do drug seizures. We would expect then that the number of overdoses or perhaps deaths within that specific area where that seizure took place might reduce. We also want to know is what type of drug was it there? Was it branded, the drug dealer, and so on, or how much of the drug was confiscated in that seizure. So another one would be for drug activity reports. Again, this is to monitor the intake of public that has reported a drug activity in the area, like the one that we reported, and see what type of activity is happening. So a good way, again, to monitoring what's going on in your community. And the last one then is, okay, how much have we prevented? How much potential for drug activity has been taken off the street using the drop-off locations, and we can compare the last 90 days to the previous 90 days in terms of pounds of drugs that have been received. So another way for you to be able to keep track of what's going on in your community. All right, I'm going to stop again one more time and see if we can answer some questions here, Heather.
Yeah, Jessica had a question regarding the dashboard. Could you include record saves and those who were given naloxone and saved, as well as how many doses were given for the save? Can you add that information to the dashboard?
You could add, if you have that information, you could add that for naloxone saves. So whatever information that you want to track in here. I'm not really sure about how much you want to keep on there. A lot of times when that information, you may or may not be able to collect what the person's name was and all that kind of stuff. But I think if you have it, you could put it in the dashboard and presumably that if that's valuable to you. But whatever attributes you want to add. So in this case, after I after I publish the opioid incident feature service, I could go into the naloxone saves feature class and then add a couple of attributes to it if I want to add them to my dashboard, and then of course put them in the survey.
Well, don't we have those two characteristics already on the naloxone save survey? I believe we do.
We have on the survey. Let me just go back here. Oops, I just closed it.
I'm pretty sure we do. I know we have whether they were saved or like what
Yeah,
the
we have
result
whether they
was.
were saved, yes.
And then how many doses,
And how
right?
many doses. We don't have all that information, I think that she mentioned in her question, but we do have some of it already in there.
Yep.
Yep.
So there, Jessica, you could see, right, you could use those different answers on the survey plus the number of doses to do exactly what you described.
Mm-hmm. So if you wanted to add more to your survey, you certainly could, yep. So we give you a good place to start, and quite a bit of the information is already captured. Any other questions, Heather?
No, that's it.
Okay, all right. Well, we'll continue on down our march through all the applications. One of them that we wanted to show you, which we talked about last June when we originally introduced these set of solutions, was the opioid awareness story map. And this application is can be used by both public health safety officials to be able to communicate to the public what's going on locally. And it consumes the information that we have gathered in the previous applications that I showed you, including the opioid awareness maps, which is the ArcGIS Pro configuration. So I just want to walk through this quickly here so you can see what's available to you. And the first thing on the list, then you can see it gives you this overview of what's included in the story map. Again, you could configure the story map however you want, but the way we've configured it is kind of following those 4 elements of a comprehensive response. In here, a public safety official could use this to kind of set the tone. Here's what's going on a national level, according to what the graphs and the reports that come in from CDC. So you can click on that link there. It takes you to one of their reports about what's happening at a national level. But then you can also take it down to more of a local level. In this case, we've included the Celebrating Lost Loved Ones application, which if you click on this link here, it takes you out to that application and allows people in your community to share information about somebody that is near to them that they lost to the opioid epidemic. And it allows the community to say, yes, this is something that's happening here, and this is the real face of the people that have been impacted by that epidemic. So it's not just about graphs and numbers, it gets down to human beings as well. So it's important one way to make it real within the people in your community. Next, we can then add in some information about things like mortality, for example, and this would be the information that we published earlier using those tasks in the ArcGIS Pro configuration. In this case here, we're looking at a map side by side of deaths over age 25 and under age 25 within the same council districts. And so we can kind of get a comparison of what's going on regarding the number of deaths in our community that way. Another one is the overdoses. We did the same thing using those tasks so we can get a side-by-side. In this case, I just happened to choose to compare the difference between male overdoses and female overdoses in the same council districts. So we can see what the trends are in overdoses as well as in deaths as well. And then as Scott mentioned earlier, the saves. The saves are a good indicator, especially as that information is coming in, to be able to identify what's happening. So naloxone saves, again, from first responders that have reported a save. As you aggregate that information, again, up to some geographic boundary, like the council districts here, then you could create a swipe map like this, what's included in here, to be able to see, well, this is what it looked like in number of saves in, in 2015. Now, what happens if we look at it in 2016, and I can see that there's been a in general increase throughout our community in the other council districts as well. So it gives us an indication of what's happening, the trends that are happening in our area. And then again, we have the drug activity reporter. This would be helpful for law enforcement agency to be able to communicate to the public how they're engaging the public and receiving information about drugs that are happening. So it allows you to get the public engaged as well as communicate to them ways that they can participate in it. And we have the treatment options. We have locators for the treatment. It's important to communicate to the public where they can find treatment facilities and where they can drop off drugs as well. It's, again, it's a way to communicate that information. Here's a way that you can participate by going to one of these locations and dropping off your unused prescriptions. And then we also have the pain management locator in here that can be used to communicate where people can go so they don't have to go and get an opioid prescription. And then, of course, you always want to have some page in here where you can provide additional information that you could customize for your specific community as well. So this opioid awareness story map is a tool that you can use then to consume all the information that you generated from the previous applications I showed and communicate appropriately out to the public and get them engaged. So that's one type of public engagement. Another type of public engagement is something that we've been working on for a future release, and that's what we're calling our Opioid Hub, or it's a kind of, if you think of it as, it's kind of a destination for citizens to get engaged in a specific topic, in this case, the opioid epidemic. And this is something we've been working on. We're going to be getting some information or input from several of you users on what should be in this hub, but it's a way for us, another way for us to be able to communicate to the public of what's happening locally. And as you can see here, there's a couple different ways you can do that. These cards on here allow us to communicate some of the key performance indicators that are happening, such as number of deaths, overdoses, and so on in the current year back to the community. So it's a way for folks to keep track of what's happening. We can also get them involved, tell them where they can go to dispose of the drugs, where they can use prevention, such as the drug activity reporters, get treatment, and so on. And then we have some of the applications, so the drug drop-off applications, the pain management, opioid treatment, and the drug activity dashboard. So it allows, or excuse me, the reporter, I should say, it allows you to be able to provide these as tools to your citizens so that they have a place that they can go and find all the necessary information on the epidemic. And then of course you might be able to provide them some data as well. Each one of these could contain sets of layers that you want, and then use it as a way to promote the National Take Back Day. If those of you that may not be familiar with this, there's usually 1 or 2 days a year that are designated as National Take Back Day that communities all across the country participate in, and they can promote where you can drop off drugs and get them off the street. So it's kind of a thing that you can do on a regular basis. So this data hub, or this open source hub, could be something that you might want to consider. I want to show you an example that Scott showed me actually of Oakland County. This is a website called Access Oakland, and they've done something very similar that I thought was really important to show you guys so you can see what's happening here. In here again, they have their key statistics for them, which happen to be opioid prescriptions that were filled in 2016. So that's also gives you an idea of are the prescription rate going up or down, how much they've collected in the direct take back day, and then how much they are spending or how many people are out there doing outpatient treatment. It also provides a way for you to communicate out what's happening, what if there are some news releases, and so on. And you'll notice that down here they have several different apps, again in those categories like education, what's happening within our community, how many deaths happened in each one of these townships. So they're communicating that, they're being straightforward, trying to give that information out to the public to help, again, get the public engaged. How many prescriptions are occurring, and the same thing, they have aggregated these to the township level. As I scroll down, you can see they've also included the Celebrating Lost Loved Ones application. So they give their residents the ability to go in the application and put in information about somebody that they may have lost. Again, it brings it real to that community. In terms of prevention, they have the drug drop-off or disposal locations in here, so you can find them, what type and where they are. Some prevent addiction facilities. They have treatment and recovery facilities. And then finally have a list of different types of recovery facilities that you can get access to. So again, one way to communicate this information back out to the public and get them engaged in participating in what's happening locally with the opioid epidemic. And there are many different applications that we've shown you here today that you may choose to use. You don't have to use them all, but of course, whichever ones you think are going to be helpful to you. So before I turn it over to Chris, I want to wrap up and see if we have some more questions. Heather?
No questions.
More questions, okay.
Walt, I do think you made a really good point at the end. It's hard, right, as you're going through things, not to feel there's a lot of stuff there. And so I do think it's important, that point you made at the end, right, that as an organization, you know, communities can pick one or more of the solutions to deploy, and they could either choose to focus kind of on an individual area, maybe on education or treatment, or even prevention, right? Like you said, because a lot of communities are participating in those take back programs. So there are really simple ways you can get started and then evolve the offerings maybe into a more comprehensive and collaborative way as well too going forward. You can kind of grow into it.
Right.
Yep.
Okay, so that's I spent quite a bit of time talking about that, and what I'm going to do now is turn it over to Chris so he can share a little bit about what we've been doing with homelessness and how you can find and deploy some of these solutions. So Chris, I'm going to stop sharing and turn it over to you then.
Thanks, Walt. All right, so what I want to take some time to talk about are some of the maps and apps that we've built to help communities understand the extent of homelessness and also allow homeless individuals or families at risk of becoming homeless to find resources in the community to assist them. What you're going to see in this presentation is a lot of similar technology and apps that we leveraged with the homeless solutions that you saw for the opioid epidemic solutions, but they've been leveraged for specific workflows that health and human services agencies would use for homelessness. So the first app that I want to focus on is the homeless point-in-time count. And the Department of Housing and Urban Development, or the HUD, requires that any continuum of care communities conduct an annual count of homeless persons who are sheltered either in transitional housing, emergency shelters, and safe havens. They also require a count of unsheltered homeless persons every other year, or on odd number years. So the HUD provides a couple model surveys that can be used to conduct these sheltered and unsheltered surveys. Here's an example of the unsheltered survey form that the HUD provides. It has several different questions, and you can see there's some flow in here. Depending on your answer, you would skip ahead to another question. If they're an adult or a child, you might omit or add questions depending on the scenario. You also would potentially repeat the question for the number of individuals in the household for that homeless family. So there's a lot of questions in here, and there's a lot of kind of logic flow and steps that you would take when conducting this survey. So we really wanted to do two things. We wanted to create a digital form that would allow health and human service agencies and their network of volunteers to go out on the night of to conduct the homeless point-in-time count and collect that in a digital form. And we also wanted to include some of that logic flow into the form. So as you answered particular questions, it would expose the necessary next questions or the required next questions depending on your responses. So to do that, we used Survey 123. So let me go ahead and show my example. Using Survey 123, I can access this survey in a couple ways. I can access it through a web browser, but I want to kind of show what the mobile experience would be like, because that might be common if I was going out in the field and I was actually conducting these homeless surveys in person. So I can select my homeless count survey and start collecting. So the first thing it does is it pre-populates the date with the current date and time. I can add my name. I can indicate whether the person is in a shelter or not. So this gets at whether it's the sheltered or unsheltered survey. If I were to say yes here, I would get some additional questions such as the name of the program and what type of shelter is it. In this case, it's going to be an unsheltered. I'm asked a question if I'm able to survey the person. So there may be scenarios where you're unable to get to the homeless individual, or the volunteer potentially doesn't feel safe or confident enough to go up and talk to the individual. So they might want to just observe and fill out some information. So the HUD does provide a mechanism for you to conduct the survey as an observation rather than an interview. But in this case, we are able to. It provides some text that the HUD outlines here that you can read off to the individual to let them know what you're doing and why you're doing it. I'm going to ask if I can have some of their time. We want to know if they've already been surveyed. So we don't want to double count someone if they've already been surveyed that night. So in this case, no. Where are they sleeping? So if we go back to the form here, you can kind of see here's a question where, depending on their response, we might continue on, or otherwise we might stop. If we're conducting an unsheltered survey, we want to ensure that they're sleeping in an unsheltered location, not that we just caught them on the street, but they're going to end up in an emergency shelter. So that would change kind of the direction of that survey. So in this case, we'll say they're on the street. It asks how many individuals, including themselves, are in their household. So if I select one adult, you can see I have a household question section here. If I add a child, you can see now it's one of two, one of three if I have two children. So this is, as I'm specifying the number of people that are in the household, I'm going to repeat this section of the questions for every individual in that household. I'm just going to say there's one adult. I can add some the initials of the person. If I'm interviewing a second person in that household, I want to know how they're related, but I don't need to answer those for the first person. How old are you? If you enter less than 18, some questions are restricted from the survey because we're only intended to ask those to adults. So it's using that. Are they Hispanic? What's your race? So this is a multi-select, so I could check multiple if they fall into multiple races. Gender. Have you served in the armed forces? If I were to say yes, I'm going to get additional questions about if they've received any benefits or things of that nature. If I answer no, it asks if they were called into active duty as in the National Guard. I'm going to say no to that. Is this the first time you've been homeless? So this is an important question that the HUD is looking to understand the level of chronic homelessness in the community. And chronic homelessness has different criteria. For example, how many times in the past 3 years have they been homeless, and for how many days? So if it hasn't been their first time homeless, I want to know how many times have they been homeless in the past 3 years. And how many days have they been homeless this time? 4 more times, and in the past 3 years, a total of 500 days. So this gets us to understand whether it's a temporary issue or if this person is consistently having trouble maintaining permanent residence. Here are some of the questions that we're asking only to adults. Do you drink alcohol? Any emotional conditions, physical disability? Have any of these situations prevented the individual from holding a job? Received any special education? Have AIDS or HIV? Disability? Or been physically, emotionally, or sexually abused? So these are all questions that we're pulling right from the HUD model forms. Certainly, if you want to collect additional information in addition to this, you could modify the survey and extend it and ask additional questions. I'm then going to select my location. If I was on my phone, I could actually use my current location. So I'll just place it somewhere there and submit that survey. If there are additional people in the household, then I would ask those additional questions. Otherwise, I would move on and conduct additional surveys. So that's how I can conduct the homeless point-in-time count. What we also provide with this solution are the ability to get some real-time information about the night of count. So like I said, typically these surveys are conducted on a single night in January. Both the sheltered and unsheltered surveys, and we might want to get some real-time information about this. So this dashboard is hooked up to that same service from that survey. So I can start to get counts of the total number of homeless, both unsheltered and sheltered. I can get some different high-level information like the number of adults, number of children, number of veterans is an important number that we also want to capture. And then getting to some of that chronic homelessness. So how many people is it their first time versus multiple times in the past 3 years? And on average, how long have they been homeless this time? And the total days, total number of days that all the individuals have been homeless. The other thing that Walt kind of showed as well with Survey 123 is I can get some of that detailed information. So this is really powerful to explore that data and start to understand some of the trends in the data. What I can do in the Survey 123 app is I can also kind of switch these up. So if I want to look at it as a bar or a pie chart, or even on the map, I can see that information as well. So that all comes with Survey 123 when I deploy one of those surveys. So the next application that I want to show, the next solution, is the Homeless Activity Reporter. And this application is also a configuration of Survey 123, and it can be used by the general public and other engaged organizations to report the location of homeless individuals and encampments in the community. So whereas the Homeless Point in Time Count survey is typically conducted on a single night in January, this Homeless Activity Reporter application can be used year-round to get a sense of where the homeless are in the community. And oftentimes engaged organizations or volunteers will want to know this information and be able to leverage this information to go out and provide assistance, to provide them information on where they can seek shelter or other services like food banks or educational opportunities or opportunities to be placed in jobs or more permanent housing. Those engaged organizations can use this information to find those individuals and work with them. So using Survey 123, we're going to enter some additional information such as I found an encampment, any details I saw, take a photo. If I'd like to be contacted with more information, I can do that as well. And then the location that I observed that at. I also have a configuration of Crowdsource Manager on top of that application that allows me to view those reports and get some more information. So this would be used by the Health and Human Services Organization to stay on top of any reports that are coming in from the community. And then I can use this to see some additional information. So we found a shopping cart that looked like it belonged to a homeless person. The individual submitted a photo, so I can see more information about that. I can actually edit this, and I can update the status that it was received, and I could assign it to someone to respond to. And this list could be configurable, whether you want to assign it to particular organizations within or particular individuals within the organization, or if you have a strong network of volunteers or other engaged organizations, you could collaborate with them and how you would respond to these different reports. The next application that I want to go into is the Homeless Service Locator application. And this is very similar to many of the Locator applications that Walt showed earlier, but here we're focusing on facilities and organizations in the community that are offering services to the homeless and families at risk of becoming homeless. So I can search for an address, or I can just click on the map, and it's going to find these different facilities in my community within a given buffer distance that are offering different types of services. And you can see that they're kind of categorized by the type of services they offer. So if I'm looking for some emergency shelter or a place to sleep for tonight, I can find some of those different locations. I can click on them. I can get additional information like their address, a link to their website, some comments about the organization, and I can also get directions to that location. So one thing that was interesting when we were going through this work is we were thinking about this particular application, and we really thought about, well, the audience for this application is going to be the homeless individual in many cases so that they can find these. Does it make sense to have this as a web application? And we really found through research and talking with people that many homeless still have access to mobile devices, and they can access the internet, and they have that capability. So it's not out of their reach to find this information. But we also felt that this application could be used by volunteers or interested parties in the community who want to be able to donate their time, food or supplies, or their experience to these different organizations to help homeless individuals. So there's kind of two folds with this application and how it can be leveraged. The last application that I want to show is the Health Resource Inventory application. And this is a configuration of Web App Builder. And this application can be used to inventory the facilities in the community that are offering different services around public health. So Walt showed the drug drop-off. He showed the drug treatment locator application. He showed the alternative medicine application. I just showed the homeless service locator application. All of those applications are relying on facilities or point features to locate around a given location. This application can be used to inventory or to manage the location of those different health facilities in the community and provide the information about those facilities. So for example, if I want to add a new drug drop-off location, I can select the template here. I could search for an address, or I could zoom into the map and click on a point to add that facility. And then I can provide some details about that drug drop-off location. The name, its address, whether it's a public or private agency, when it's open, and any contact information, as well as some final comments. When I submit that location will now be available in that drug drop-off locator application right away. I can make that available to the community. I would do the same thing for the homeless service locators or the drug treatment locations. They're all being managed from this single application, which makes it really powerful. I also wanted to highlight the open data site, similar to what Walt showed earlier with tackling the opioid epidemic. We're also working on and are in development of an open data site for reducing homelessness. And similar patterns are in here. We want to talk about the problem. We want to be able to educate the community on the extent of the problem and why it's so important and critical that we're focusing on it. We want to talk about what we're doing right now to address it and to try to reduce homelessness in the community. And we also want to communicate, let the public know about the applications that are available for them to learn more about how they can help, or for homeless individuals and families at risk of becoming homeless to find out how they can get help and prevent them from getting to that point. And we also want to advertise or talk about any events that are coming up, any events that we're working on, that we're looking for engagement in the community. So those are the applications we have around homelessness. Before I wrap up with how you can get access to these applications as well as the opioid epidemic applications, I wanted to take some time for some questions.
There are no questions at this time.
Okay, cool. So how do we get access to these applications? First step is to go to solutions.arcgis.com. This is our landing page for all of our ArcGIS solutions. I'm sure many of you have come here before, but what was new this year that we released in June with the release of these different applications is a new page for Health and Human Services. So if I go to the Health and Human Services page, we're going to see a couple different sections. We have tackling the opioid epidemic, we have reduce homelessness, and we also have combat vector-borne diseases, which are our maps and apps around mosquito control. I can go into any of these, so if I want to learn a little bit more, what we'll see here is we can see some of the maps and apps that Walt demonstrated earlier. Some of the apps around educating the community. Here's the opioid awareness maps, that ArcGIS Pro project that Walt demonstrated first on how you can load in some of your overdose and death data into feature layers so that you can share that information and make that information available in the community. I can also go, I can see some of the try it live versions of the applications. So the applications that we demoed today, if I want to look at and play around with the naloxone deployment reporter, I can click view application and I can enter information, and you can play around with the applications that we stood up so you can see what they look like. If you want to learn more about how you can deploy that application, you'll get all of that information here in the help topic. If you come to get started, you can learn about how you can deploy this survey, either by publishing it or in the automated approach. So I want to talk a little bit about that, specifically how you can deploy these applications in your organization. The first thing, for any of the Survey 1, 2, 3 configurations that we have available, if I come into the Survey 1, 2, 3 Connect application, what we've done is we've made those surveys available as a template available to the community. So if I click New Survey and I come in here to the Community tab, if I search for opioid, I'm going to see that naloxone deployment reporter available, as well as the opiate death reporter and the opiate overdose reporter. I think we also have the drug activity reporter here as well. So I can select that survey, give it a unique name, and hit create survey. And that will create a new survey with the base that we've laid down. And you can publish that survey and share it out and start using it. So it makes it really easy to deploy those surveys in your organization. The other thing that you can do that we document here in the automated deployment approach is to use the ArcGIS Solutions deployment add-in to deploy these solutions. So here I'm going to come into ArcGIS Pro. And when you deploy the Solutions Deployment tool, what you'll get is a new button on the Share tab called ArcGIS Solutions. When you click that button, it's going to open a task in the task pane. The first step in that task is to sign into your organization. And this is going to be the ArcGIS organization that I want to deploy these apps to. Once I've done that, I can deploy a solution. This step is going to show to me all the solutions kind of grouped by industry that are available for me to deploy. If I come up here and search for opioid, I'm going to see all the opioid epidemic apps that are available for me to deploy. So I can select one or more, pick a folder in my content, or I can type a new name and hit deploy. And what that's going to do is it's going to run through each of those applications and stand up the feature layers, the web maps, the apps, the surveys, the dashboards, whatever is required by that particular solution. It'll stand that up in my organization, and then I can start using it. So it's a really quick way to get these applications stood up in your organization so that you can start to evaluate them and decide whether they meet your needs or they're what you need them to be. And then at that point, once you've played around with the apps and you've discovered and learned what they can do, you can start to customize them to meet any specific needs in your organization. And it's running right now, but we also have additional steps in this task that walk you through things like adding or removing fields from any layers that are created. We also allow you to update domains or add new domains to the feature layers. And then you can also modify things in the web map, such as the symbology, any layer filters or things like that. And you can also brand the applications, some of the web apps. You can add your own icon, change some of the colors of the applications. You have that capability as well once you've deployed the application. I guess that in summary, what I'd want you to take away from is we showed a lot of apps today, both for the opiate epidemic and the homeless apps. I would really encourage you to go out to the website, check out some of the ones that you're interested in, use the try it live versions to kind of experiment and see what they can do. And then you can use this solution deployment add-in to deploy one, a couple, or all of the apps really quickly to your organization and start using them. So it's really a quick way to get started. If you don't like them, you can delete the apps, and it's really no harm to your organization. You can just stand them up and play around with them and use them before you ultimately share them with everyone or share them within your organization and start using them. So the drug activity dashboard completed here. So I can click this link and it'll take me out to that particular item in my org, and I can start using it. So with that, I guess the last step, come back here. We'll open it up for questions.
There's one question that Scott had answered, and it was in regards to data. So how do you handle many incidents to one location? Do you use related records or have many points for the same location?
I think they're talking about the opiate incident maps probably, and death and overdoses. And each incident is its own unique record. So if it does happen to occur at the same address, you'll see a whole series of points stacked. And that's pretty typical with crime and incident data like that.
Yeah, that's right.
And then Dwight has a question regarding homelessness. How does the housing department connect to the homelessness or homeless survey to match a person with housing? He said often homelessness does not find local housing, and it is chronic.
Chris, explain how, like, the HUD survey is a very specific thing, and that typically governs funding, right? But kind of explain that for a minute. Like, where does the data go once they do that survey, that biannual survey?
Yeah, so I talked about the continuum of care communities, and those are kind of it's a categorization under the HUD of communities that are receiving some funding from the federal government towards reducing or assisting the homeless population. So the point in time count specifically is done to get a good estimate of the number of individuals that are homeless in that particular community, and that directly translates to funding. But it also can be used by any community to understand the scope of homelessness in the community and how they're kind of performing from year to year. It can be used as a baseline for that. So I'm not sure if that answered the specific question. Could you repeat that again about connecting?
Yeah, I think so. Then the other thing, how do you connect? So basically, Chris, can you use the intel that you're gathering from that survey, plus actually probably more appropriately, maybe even the homeless activity reporter, which is really kind of a everyday observation that citizens could submit.
Yeah.
Right. That could definitely be feeding directly to housing and others in the community that are working on the homeless challenges in the community, right? That could be the kind of real-time feed that's giving them a sense for where homeless individuals are in the community, right?
Yeah. Yeah, I definitely think so. I think that a lot of what we provided is tools to take what was often in a paper form and maybe lacked location to a digital form with location, so you have a better sense of the extent, both the numbers and the spatially where the problems are. We certainly see the need for additional solutions in the future that then start to take some of that information and how can we start to take action on it and leverage that information. So I would say that we don't necessarily have apps there now, but we're definitely interested, and if there are individuals who are interested in working with us on coming up with some of those apps that could help in better connecting individuals with resources in the community to help them find permanent housing, we'd definitely be interested with working in with anybody on those.
Okay. Yeah, I think that pretty much answered your question. The next one is, can Survey 123 handle related records? We have multiple departments with differing forms that respond to a single location?
So what I showed in the point-in-time count survey, where I indicated how many individuals were in the household, whether there was 1 or 2 or 3 adults, and how many children, that triggers a repeat question in the survey where I would answer the same thing X number of times for every individual in that household. Those questions and those responses are actually stored in a related table. So that's how Survey 123 handles that scenario, a set of repeat questions. It's a one-to-many relate between a layer and a table. If you have an existing layer that has a relate, you can author your survey and have it point to an existing layer in your org. So you could have 2 surveys that are pointing at 2 different layers that have some type of relationship. And all Survey 123 would do is write to the layer it knows about. So you would have to have some mechanism in the way that the people are responding to fill in that foreign and primary keys so that those records are related. But that's one way to handle existing layers in your organization if you just want to populate them with Survey 123. If you have more specific questions about that, I'd be happy to help, and feel free to post to the meetup and I can follow up with the specific scenario.
Okay, great. It doesn't seem like there's any more questions. Is there anything else that anybody would like to add before I wrap up the meeting?
I think we're good, Heather.
Yep.
Okay, perfect. So thanks for joining us for today's meetup. We look forward to seeing and hearing from you at our next meetup, which is Thursday, November 16th, where we'll be providing an overview of our public engagements, maps, and apps. And until then, have a great afternoon, everybody.